That was fantastic. Thank you. Lots of good information there and record-setting pace, too. So the second talk in this session is coming from Heidi Larson, who is an anthropologist at the London School of Hygiene and Tropical Medicine. And Heidi's also the director of the Vaccine Confidence Project, which I can see on my screen, but you can't see on yours yet. So me gesticulating like this makes no sense. The Vaccine Confidence Project. There we go. Excellent. Those magic fingers. Super cool. Vaccine Confidence Project is an initiative that is incredibly awesome. It's basically a surveillance system for public opinion. I'm super excited to hear about it and super excited to hear about responding to misinformation and rumors. This is something that as a planning committee were coming up with the content for the workshop, came up early and right away and said, okay, we should have something on this. But then to see all of our presentations this morning, virtually everyone talked about misinformation and how critical it is to deal with those, including Dina's just now. So to get the facts on responding to misinformation and rumors, Heidi Larson. Here's your controller.
It's not a rumor. Okay. As you can see here, I put this one up there because a lot of what we talked about today is not new. The shape and form of it and the way it's traveled has changed. I put this quote up here because I think when the Executive Director General of WHO acknowledges that we have a problem in this area, it's not a UN organization that is quick to want to face problems, but in this case, Margaret Chan's actually been quite an outspoken on the issue of our post-fact society and its impact, particularly on immunization, but in general. I put the cross over the may, and I think she would agree. In fact, I know she would agree with me. It should be our fading. Basically, the days when health officials could offer advice based on the best medical and scientific data and expect populations to comply is fading. She basically, when people are quick to beat up WHO for not having done a great job in terms of the rapid response to Ebola, and I do not disagree that they definitely could have reacted more proactively and quickly, but I think people forget that not too long before Ebola, WHO had really been outspoken about the concerns and about the H1N1 pandemic, been very proactive with that, and got terribly beaten up for that as having inflated and overstated an epidemic. It's a difficult space. It's uncertainty. You look at that dimension of what's the risk of something happening versus, even if it's a small risk, what's the impact of it on public health and mortality. But we didn't do too well. And when journalists asked me, well, you know, you've been studying all this issue on vaccine refusals around the world, what's the thing that keeps you up at night? And for me, of all the different vaccines, we do a lot also on HPV, among others, but the one that really concerns me is how badly the world behaved around H1N1. Horrible non-compliance around the vaccine, and it's not just a US phenomena, it's not just a Europe phenomena. I got a call from the Ministry of Health in India saying, can you send someone from your team over to start to find out why did 85% of our nurses and trained health professionals in one of the states refuse this vaccine? I have a global network of researchers, and I've heard also in Asia. And what's particularly concerning to me is that this is just not the public. We've talked a lot about the public today, this morning and today, but actually we really need to think of the multi-layered perceptions issues. It's not just the end users. We've got people in the middle, the gatekeepers, the health professionals, and gatekeepers outside of the health community that we really need to put our lens a bit wider. But this just reflects some of the, I'm sure you're familiar with. This is a bit more about the global picture, but it's not just about H1N1. I mean, we've had continuing and growing issues around anxieties around the HPV vaccine. Again, the pandemic, MMR, I'm based in the UK now, and the UK has been very happy to have gotten over, finally, 15 years later, got over the MMR concerns, and finally, it was really just last year, recovered to pre-1998, pre-Wakefield anti-MMR, or research that suspected the MMR link with, well, it wasn't actually autism, but bowel disease related to autism. They are congratulating themselves, but I got into the airport in Nairobi a couple years ago, and in the business lounge, in the equivalent of the Kenyan Financial Times, opened up on their weekend magazine section, "Are vaccines making your child mentally ill?" It was about MMR. A few months ago, I got called from Malaysia. There's a huge anti-MMR group emerging. Did I hear about the issues with autism? This is not, I mean, these are, and even when I was working on the global immunization communication at UNICEF with Irma Manencourt, we were already then getting calls saying, why is UNICEF providing those single-dose measles vaccine? Is it because you know better? I said, frankly, it's because these countries can't afford the MMR, but we were already getting questions about this. This issue is very global. This is just some of the other literature that's come up around it. And I think one of the points I want to make here is, one, this is not new, but the shape and form of it have changed. People say to me, oh, this is all because of the internet. And I said, well, it's not just because of the internet. The internet has absolutely, and social media, smartphones have absolutely amplified the situation, but these issues are deep and historic. This is one of my favorite historic pictures. In our esteemed London School of Hygiene and Tropical Medicine, which is in a very old historic building and has a lot of historic books, we received just a couple years ago a whole library of fantastic old, perfect condition books on vaccination that one of the alumni or parents of grandparents of alumni had been collecting, including Jenner's first edition book on smallpox and variolation and how it worked and why it worked. Well, and we also had a visit a couple weeks ago from Bill Gates, who met with some of us on our different areas of research. And I walked over to this book and we were looking at it. He was fascinated by it. But then I showed them, by the way, when we received this book, we opened it and the cover said, this book is the property of the Southampton Anti-Vaccination League. So I said, well, Bill, we eradicated smallpox, so there's hope for polio. This is not new. But then I loved on the page that actually characterized the F's are S's, if you kind of leap forward a century, in its Old English, why and how this principle of variolation works. In the margin there is, what humbug. So this is not new. The language has changed a bit. So I give a number of talks and I have a course on risk and rumor in global health, but sometimes I start my rumor lectures by saying rumors actually have a bad reputation. And if you think about it, every reference to rumor this morning has really been about negative or complicating issues around rumors. But it's actually, rumors by definition are a yet unverified piece of information. And a lot of you know that the idea that a rumor has a grain of truth is most of the time true. Whether it's actually true, it's like our having to confirm and investigate adverse events, they can be valuable signals of issues. I was talking with Larry Madoff, who we've collaborated a lot with, and the ProMed work that's scanning and monitoring media around the world to listen for signals of disease outbreaks. So they can be important, so we can't brush them off. And that was a big mistake in a couple responses, waiting until we had an outbreak of disease rather than paying attention. Epidemics can be sparked, financial markets crashed, and political leaders overthrown or voted in because of rumors. And I think one of the things that one of the previous ministers of health from Nigeria said, Heidi, if we had been able to read some of the work that's going on now and some of the things you're doing, as well as there's a growing number of people working in this space, we would have never had this boycott because we had plenty of signals early enough and we said, they're just a rumor. These are some of the examples of rumors as signals of disease outbreak. The Global Health Security Agenda, this is profiling a project in Vietnam. And in the narrative on the page, I just pulled this part out. A parent hears rumors from other parents about several children bitten by a rabid dog. A teacher sees an unusually high number of children absent and that they all have similar symptoms. Could be a coincidence. It could be a local disease outbreak, or it could be the first sign of an epidemic. This is a rumor we have to pay attention to. So I think that it's just an example. And also go on the Global Outbreak Alert and Response Network. That's another group. It's a newer group, but if you go back at WHO, there was a system for listening for rumors, assessing their epidemiological significance and determining actions needed. If we think of it from a disease detection framework, but apply it for other areas, we can take them more seriously. Not all of them, and that's part of what our work at the Vaccine Confidence Project is. How can we triage? How can we triage and pick up what are some of the characteristics of rumors that we should say, this one you pay attention to, don't worry about this one. And what we're seeing is there are real windows on underlying belief systems, personal histories, political histories, and environment, and whether they're fact or fiction, they can and do have serious impacts on people's individual and collective behavior. They're also traveling globally. One of the big things we're doing is trying to get a global picture on these and how, especially in this highly connected world, how they're traveling and evolving. This was in a study called Tracking the Global Spread of Vaccine Sentiments. It was particularly following Japan's suspension of their HPV recommendation of June of 2013. It's just against all the scientific evidence. The Ministry of Health told me in blunt terms, Heidi, we know very well that there are no investigated causal links. We're politically paralyzed. And politically paralyzed because the anti-vaccine groups are influencing the government, and also they've had a serious impact on the shift in the tone of popular media. Well, Japan is an interesting bedfellow in Denmark. Two health professionals who met at a rheumatology meeting, exactly where they know all about vaccines. Doctor, I've seen in a lot of these, in the emergence of doctors commenting and taking different views, not always positive about vaccine. If you really look at what some of their doctor credentials are, from veterinarians to doctors of I don't know what, are using that credential to get credibility. But anyway, this map has a lot more lines since we published this paper. But these issues are traveling fast, and there's an old saying I'm sure you've all heard, when the U.S. sneezes, the world catches a cold. Well, when the U.S. has some rumors, the rest of the world starts questioning vaccines, and I think it's highly underestimated here how global that impact is. But it's not just that way. It's the other way around. When in some of our work, I just need to go on to anti-vaccine sites in the U.S., and they can tell me all about what's going on in the rest of the world, because they're searching for any evidence to rationalize their concerns, whether it's a village in Bangladesh, where a child is reported reacting to a vaccine. In India, in Ouagadougou, it's on their site, and they're saying, you see, they're not telling us the truth. Rumors have public health impact. The lines on the last map were actually sentiment and perception. On this map, it's disease. The rumors were geolocated in northern Nigeria from 2003 to 2004. There was a boycott of the polio eradication initiative, and it went on for 11 months and led to 20 countries as far as Indonesia being reinfected with polio, and that line that goes down below actually should go via Mecca, which is really where it traveled from. This is one point in this one is that that was in 2003. These things reemerged, but in Pakistan in 2013, related to a lot of things, but including CIA issue that I'm sure you've read about, and then led to killings. These things also circulate. Some of those same sentiments leaped over to Kenya and Catholic bishops, and then jumped vaccines to tetanus vaccines. These things leap countries, and my time is up. Okay, I'm going to really race through there. You said I have a couple extra minutes, maybe? This is on the basis of that, the problems I just presented. We set up this project to try to anticipate. We created a diagnostic tool, find the triggers, assess the amplifiers, because that determines which triggers are more likely to spread, and then assess the impacts. This is a trigger. This is one of my favorite ones. Now, if you know better, you'll know it's joking, but this wasn't in a joke paper, and for people who want to believe it, will help them. I'm reading a lot on the psychology of rumor and crowd psychology. Again, that's not new. The study of the popular mind was 1895, psychology of rumor in the mid-40s around the Second World War. Gordon Allport ran a rumor clinic in Boston to be a place where people anxious about having no news from their sons or nephews or husbands in the war would go to the rumor clinic. It was a way to calm anxiety and social unrest. What's interesting to me is the psychology around crowds and around rumor were both around huge violent war, conflict, disruption. The crowd refers a lot to the French Revolution. I don't know what that means for current times. If you see that these books were written with retrospect to conflict, the decline in deference in politics is also not new. It's dropped dramatically since then, but this was already 84. As I said, we're trying to monitor it. We spend a lot of time coming up with metrics to try to put our finger on the pulse of public confidence. We see that public confidence in vaccines is very much a window on public trust in government in particular, but also in systems. This is a study that we released this in September in 67 countries. Europe and Eastern Europe won the prize in being the most skeptical. France, 3 to 4 times worse than the rest of the world in terms of their skepticism around vaccine safety. The government knows it, and we reached the cover of the Le Monde for a weekend, and it was really viral. They're anxious. 2 years earlier, what we try to do is multiple indexes. That was survey, but we're also doing media, social media. This was with Larry's group at ProMed, doing global monitoring of media and social media and coding it by tone. And what's interesting is what we got out of this was not dissimilar to what our survey results. You can see where the darkest negative confidence is. It was similar to the other study. We didn't have data in the surveys for the 2 dark countries in Africa. We're currently running that right now. Sometimes the solution lies outside the vaccination program. I think we don't look beyond our halls of health to think about what the outside will, how it's affecting. We did an analysis of the Nigeria boycott, and these were just a few of the players involved to give you a perspective of, and OIC is the Organization of Islamic Countries. We're currently leading on the community engagement, rumor management around one of the Ebola vaccines. We have social science teams being the ears and eyes for rumors, constantly cycling back to the outreach team and then liaising with the clinical teams. It's been really effective. We went through a number of different ways to do this. And one of the three domains that we see that have been so important in the success so far in this trial and the engagement of enrolling participants was this dynamic, but power, fairness, and trust. It's not information, it's about dynamics, it's about relationships, it's about trust, and it's about fairness, and I would add dignity and respect. These are not pieces of information. These are about relationships. These are about emotions, things that we just don't pay enough attention on. A couple countries over, the phase 1 of the same Ebola vaccine trials, the trials were shut down because of rumors. It was a country that we actually expected things to go well, but it was political rumors. I just have a filmmaker who spent 10 days there interviewing a lot of these people. We're trying to build modules and case studies so we understand moving forward. So this, my efforts and the team to understand the public is not always perceived as a good thing. You think these people are happy that we want to listen to them finally, right? No, she's spying. They somehow found my picture and posted it. This is a group called the Refusers. They found, where they put me next to Tokyo Rose, who was listening to the other side in the Second World War, they said, well, the only thing Larson's doing right is one thing. It's a total waste of time to spout pro-vax propaganda to vaccine refusers. So anyway, that's what I deal with sometimes. So this is one of many. I'm really popular on the anti-vaccine sites as a victim of all of our hubris. This was just a recent article. Science said there's too much going on. We need a commentary on it. And so this was on the limits of information. I should say information alone. We need information. These are the last couple slides just to reiterate. Fear and emotion are some of the neglected dimensions of health. We cannot, I wanted to have a slide here saying messages are out, dialogue is in. Every time we think of message, we need to think of the medium. We need to think of the context. I got pulled initially into comment on the Ebola outbreaks because it was so similar to what had happened with polio, health workers being killed, the extreme distrust and fear and uncertainty. This was the head of the Médecins Sans Frontières in Guinea, who said, after reflecting, instead of asking for more beds, in retrospect, he said, we should have asked for more sensitization activities. And just, we did our kind of benchmark report last year, and I just ended it saying, current and historic examples speak to the importance of time, context, past, present, and future, and never, never, never assume what's in the minds of people, and never forget that they can change. So I'll leave you on that note. This is our website. The commentaries change, and every day we pick 5 of the latest news stories about issues in the world and literature. Thank you. Sorry I ran over.